Alright guys, so we're going on to talk about what mesothelioma. Now mesothelioma, the most popular one is the one that actually occurs in the lungs. But you get to see that there are different types of what mesotheliomas. Alright, different types of mesotheliomas. So carefully we have images on this one is a lungs one, this one is a heart one, that's pericardial mesothelioma, this one is a peritoneal one, this one is a tunica vaginalis one. So be careful, take time and look at all those types of what mesotheliomas. So this mesothelioma is a rare and aggressive form of cancer that develops in the mesothelium. So this is a thin layer of tissues that cover many internal organs. So mesothelium is not only found in the lungs, do you understand? So mesothelioma can actually occur in other parts of the body too. Alright. So what are the types of mesothelioma, which is the main reason why we are doing this lecture? We could have the pleural mesothelioma. This one affects the lungs, the tissue around the lungs, and it's actually the most commonest type. Right? Most of the times it's due to your occupational risk. So occupationally, you are predisposed to all these asbestos and all of that. Then we have peritoneal mesothelioma. This one is tissues in the stomach. So I did not, okay, yeah, peritoneal mesothelioma. So there's a place, right? So tissues in the peritoneum is what actually affects it, right? Then we have a pericardial mesothelioma. This one is a tissues, that's the pericardium around the heart, right? Pericardium around the heart. So affect tissues around the heart. Then tunica vaginalis mesothelioma, right? See that. So for the causes, you see that sometimes it's asbestos exposure. So primary cause is asbestos fibers. When you inhale it, alright, or you ingest it, so they can lodge in the mesothelium leading to cancer. Genetics, sometimes there's a family history of what? Developing mesothelioma. So other factors possibly linked to what? Certain chemicals, exposure to some radiation, viral infections and all of that. Okay. So this pericardial mesothelioma. So symptoms is for the pericardium, for the pleural one, there's chest pain, there's painful cough, shortness of breath, there's lump under the chest, difficulties in breathing, okay, weight loss, right? For the peritoneal one, there's abdominal pain, swelling, nausea, vomiting, weight loss. For the pericardial mesothelium, there's troubles breathing, also chest pain. For the tunica vaginalis mesothelium, it's just a swelling or mass in the testes, right? So most of these things are actually buried in organs. So if you want to actually diagnose, you have to do imaging. So X-ray, CT scans, MRI. Then you examine the tissue samples just to confirm the presence of what? Cancer cells. Alright. So treatment is just surgical removal of the affected tissue, chemotherapy, drugs like what? Ciplastine, pemetrexed, just to kill the cancer cells. Radiation therapy, like use high energy, right, radiation waves just to kill the cells. Then pleurodesis, that one is a procedure just to prevent fluid buildup around the lungs. So prognosis, survival rate is 5 years. Survival rate for mesothelium is about 8 to 12%. So early dictation and early dictation and treatment can actually improve the condition. Then reduce your exposure to asbestos. That's just the best way to actually prevent the disease condition, right? So that's it for mesothelioma, cancers of the mesothelium layer of tissues. Okay.